So we're really excited to be launching a rural residency program. It's something that really so many communities across the country need more rural practitioners, and family medicine is really the specialty that I think is best suited to deliver that care.
The culture of our program, it's always been collaborative, supportive, really anchored on like, why are we doing this work? Why do we care about this community? How do we better support patients in living better in the community that we live in?
Approximately 1/3 of the patient population that is seen in the University of Rochester Medical Center comes from Southern Tier. So they come from these rural areas. It's the lifeblood of the patients that we see. Across the nation, there is not a lot of rural family medicine residency programs. This is going to be one of the few.
The University of Rochester's residency program in family medicine is very, very highly regarded nationally. We are among the oldest family medicine residency programs in the country. We really have outstanding hospital-based training, so our trainees learn a lot about acute needs, whether it's emergency, inpatient hospital, and a robust outpatient practice. So those two skills combined really help people hit the ground running when they graduate from residency.
Like many rural training programs, ours is going to follow what is called a 1+2 model. So for the first year, our residents will be in the city of Rochester, getting clinical experiences that are hard to replicate in the communities where rural citizens get their care. High volume obstetrics, high volume inpatient pediatrics, very robust inpatient medicine. After the first year, our residents will be training at 2 hospitals in the rural setting that are part of the larger University of Rochester healthcare system. Noyes Hospital in Dansville, New York, which is about an hour south of the city, and St. James Hospital and Medical Campus in Hornell, which is about 20 minutes away from here.
I'm really excited about our partnership with both Noyes Hospital, with the Tri-County Family Medicine. We've had a history of outstanding partnerships with federally qualified community health centers.
Our communities see Tri-County as the primary care provider in the region. We are the leading primary care organization south of Rochester.
Tri-County Family Medicine really goes back to the beginnings of family practice. One of our founders was Dr. Paul Frame, and he's probably most famous for being one of the key members at the founding of the USPSTF. That has guided clinical decision-making for decades.
We have grown and thrived in a time when rural healthcare has suffered. This hospital is thriving and will be able to support training the physicians of the next generation for years to come.
The maternity care experience is going to always be an important part of rural training. In many rural communities across the country, family physicians are either a major or the only provider of important maternity care services.
The first year, our 1 rotation for obstetrics at the University of Rochester is really robust. Our interns spend a full 8 weeks rotating on labor and delivery as what we call first call for all vaginal deliveries up on the deck. Those residents often will graduate with upwards of 80 deliveries and really feel comfortable caring for folks in the labor, delivery, and prenatal process. The University of Rochester also houses a fellowship program for family medicine graduates. For those fellows who wish to apply for our surgical fellowship, they often will graduate with 100 to 140 C-section deliveries, supervised by our surgical family medicine faculty as well as our obstetrics faculty at Highland Hospital.
One difference maybe, or one thing that makes our program stand out, is that we are the team member. And I think that really makes our learning experience more robust because we're asked to do what a pediatrics resident does or what an OP resident does.
Our program values fresh thinking. So if you want to be in a place which values fresh perspectives and not hesitant to make changes and meaningful impact to our communities, this is where you want to be.
I love that at our program we have a very formal method of mentorship that's set up from day one. Residents are paired with a faculty member and are even directed toward co-residents and other trainees with the same interests so that they can really find their footing in our large department.
The culture of the program is what made me want to stay in Rochester. I always feel like there's somebody I can go to for help, for a little bit of levity or humor if I need that. And there are people who will hold me accountable.
Rochester is such an interesting city. It is the 3rd largest city in New York State, yet you can drive 10 or 15 minutes outside of the city and be in the middle of rolling farmland. Our rural community, where the residency program will be based, is only about an hour south of the city of Rochester. Some rural training programs, unfortunately, are hours away, and it's harder to share resources.
Rochester is a great place to live. I didn't expect to land here, and I think I might end up here forever.
So for those who come to Rochester, I'd say be careful. You may really like us here.
If you're considering joining our rural residency program, we would love to have you. We're excited to meet you. We're excited to learn from your experience and kind of grow the program with you and figure out how we can better serve folks who want to practice rural medicine or receive that training, but also serve those communities.
The most exciting part about the residency program is it is a hallmark of a hospital if you can support a residency program that you have a breadth and depth and quality of service that is both suitable to train individuals, but also to provide advanced care to a community.
So you're getting a community health center organization that's been able to do the work for 53 years, legitimate rural primary care, and marrying that with the best that academic medicine has to offer. And that's a pretty powerful combination.
So I think having the residents is going to be a shot in the arm to really invigorate the medical staff, invigorate the services that we're providing, and continue to build that trust and dependence that the community has on us.